Good evening. Well, giving birth is supposed to be one of those moments that you get excited, full of joy and just laughter and happiness. Well, what happens when you get home or right before giving birth and all you have is sorrow, sadness, and many other symptoms that we're about to talk that happen to mothers? This is another episode of Health Check. It's on Hope TV where you look and live. My name is Kerry Kagiri. Today we talk matters of postpartum depression. And to join us this time is one of our favorite gynecologists in Kenya. Karibu sana.
Thank you. My name is Dr.Wachira Murage, an obstetrician and gynecologist.
Karibu sana. And for the very first time debuting, and I know she'll be back because she's such a beautiful soul. Introduce yourself, our clinical psychologist.
Good evening. My name is Margaret Mbuthia. I am a clinical psychologist and I'm happy to be here
Yes,
this evening.
Karibu sana. Can we just define what you do one more time for anyone who's watching and they're like, obstetro, gyna what? Please.
Okay, obstetrician and gynecologist. Obstetrician means taking care of women as they deliver, and gynecologist is the care for women other diseases.
Okay.
Apart from the delivery and baby issues.
Okay.
Other diseases for women we handle.
Okay.
Reproductive health. In fact, now it's changing. Obstetrician and gynecologists are now called reproductive health practitioners.
Reproductive health practitioners.
Yes.
RHP. Okay, yes. I don't know. I'm just
Something
okay.
like that.
And for you, Margaret.
As a clinical psychologist, we offer psychotherapy services.
Mm-hmm.
Most people are familiar with the term counseling. But we do psychotherapy because it goes beyond counseling. There's assessment, there's screening, there's making a diagnosis, and then there is the treatment bit of it. And the treatment bit that we do is purely psychotherapy, we don't prescribe medication.
Okay. Mm-hmm. So who does the prescription?
The psychiatrist.
Okay.
Yes.
Very good.
Or
so
any other doctor, yes.
Okay.
Yeah.
That's amazing. When we come back, because we want to introduce our topic through a case study. But first, coronavirus. We cannot just come here and act like it's business as usual. Do you guys have your permits to drive home after this? Are you safe? You're safe? Okay. Yes. And how has that affected your work? We can start with you.
One of the things that we are seeing, counseling, let me use the common term that people use. Mm-hmm. Counseling, people believe has to be face-to-face. Mm-hmm. So with the COVID times, then it's becoming very difficult to offer that service. And then, our offices, you meet, it's private, it's small, it's confidential. But with changing times, then we are also changing the way we do things. So right now we are doing counseling online.
On Zoom?
On Zoom,
okay.
On Skype,
on
Skype. WhatsApp video.
Okay.
Yes.
Wow.
Yes.
And for you, Doctor, are people coming?
People are not really coming.
What are they afraid of?
They're so scared. They think they are going to get corona. They think, especially now the pregnant mothers, there are these questions: what will happen to my baby? So people are not coming. And just as Margaret has said, we're using a lot of telemedicine to try and sort out most of the problems. But the few that are coming, we are trying to institute all the measures that the government is advertising. Issues of sanitizing, masks, keeping distance, and making sure that all those measures are done. So, but people are really fearing to come into hospital. They are only coming when they really need to come. Yes, and that we're seeing quite low numbers, even in the hospitals, in the wards. There are quite some low numbers coming into the hospitals.
So the doctor has said, number one, they are taking all the measures. So when you show up, you will be safe. He is sanitized, he is well, we have taken his temperature, he is fine. Come and see him. Anyway, let's introduce our case study of the day. Our smile have changed because postpartum depression is real. It affects between 7 women, about 1 woman in every 7. Is that a correct statistic?
Yes.
Yes. So let's watch this video and get to know much more and thank our case study, Jane Mekwa.
My name is Jane Mikwa, a wife to one wonderful man, and we have 3 children together. Our firstborn is, she's turning 12 this year. Secondborn is 2 years and 10 months, and the lastborn is 10 months.
Being a mother brings joy in itself, but it's also a period of adjustment as new moms try to handle the changes that come with newborns. But for some women, this postpartum period can lead to a type of depression known as postpartum depression, which is estimated to affect 10% and 20% of new mothers.
One of the things that really nearly pushed me to the edge was watching my children and not able to be their mother at that time.
After waiting for 9 years, it was good news for Jane and her husband to get a second child.
When I got pregnant with our secondborn, we had I had a complication called placenta previa, which was discovered in our 4th month of pregnancy. So once the doctor discovered that, I was put on bed rest. But we thank God that all went well. We got our baby girl. We were excited. We were like, whew, the worst is over. We thank God for His mercies and faithfulness. So all was went. So I gave birth on a Thursday. All was well during the day. Come Saturday night, that is when things fell apart.
On the 3rd day after her delivery, Jane started to experience some strange fear.
A feeling of intense fear gripped me from nowhere. Then I'm looking at the baby and I'm afraid of the baby, like something bad is about to happen in the hospital. So I sit up, I call my husband.
And by the time I'd arrived, they'd already given us some sedatives to take care of her. So within 5 minutes, she conked out. So I had to stay in the hospital until she woke up. That was about 2 to 3 a.m. That's when another round of drama started. She started telling me, now, give me a book, we write what I want you to do. I'm like, okay, do what? No, just in case I go mad.
I would get lost somewhere. I can't recognize you guys. And then after some time again, I come to. So I was so afraid that what if I go and never come back? I was in hospital for a week, but eventually we had to leave, but we were given medication. The extreme and severe symptoms were for the first 4 months, and we are here at home. Feelings of being in despair. I don't want to eat, and yet I have to be forced to eat so that I get something to breastfeed the baby. So now I had to see the psychiatrist every 3 weeks, and every 2 weeks I was seeing the psychologist. The psychiatrist was to administer medication. The psychologist was to help me cope. So my husband had to, a lot of times I've taken the medication, he has to try very hard to wake me up so that I breastfeed the baby.
I had to shake her and wake her up, and that was a battle. It would take me almost 10 minutes just to wake her up. Meanwhile, the baby is crying and fidgeting all over.
I remember pushing my husband that I don't really need to breastfeed, so we can just start none. So my husband had to call my doctor and asked him, so this is what she's saying, and the psychiatrist and the psychologist both said no. At least we want her to maintain some sort of contact with the baby still, because if she decides that now she doesn't want to breastfeed at all, it's like she'll now go into that darkness of her for kabisa.
Psychologically, her husband was gradually affected.
I think it affected me. Initially, I didn't know that. We went for some bit of counseling, and they suggested that I should also go for counseling. I'm like, I'm the man, there's nothing like that. Been able to pass through much more than this. But over time, I actually realized I need this.
I was on medication for 1.5 years. Slowly, they kept on reducing Then eventually, I think when close to 2 years, now I was completely off the medication and I was fine.
Postpartum depression can linger for months or even years if left untreated. And having recovered from this condition, Jane hopes that there will be more effort to broaden the awareness of postpartum depression.
Wow, what a case study with great support right there, and also a great team that reached out to shoot that. Thank you so much. Daktari, can we now describe what postpartum depression is, and also using the case study?
Thank you very much. So this is a problem that I would want to look at it in about 3 phases so that we can sort of understand, because postpartum depression is one of them. So you look at blues, baby blues or postpartum blues, then we can look at postpartum psychosis and then postpartum depression, because the depression is the worst of them. So you're talking about postpartum blues, which normally occurs a few days after delivery, and it's self-limiting. Within a week or 2, most of the time it's gone, and you find it's a mood disorder. It's a mild mood disorder which will go with the time and then disappear. When you're talking about psychosis, it's a more severe form, because here you see a patient with some bit of confusion. They may be a bit sad, and then of course they are not even sleeping. But it can take us other 2 forms, where you'll have the patient very happy, and then at another moment it's like a mercurial kind of a thing. That's how it is described, and I'm sure Margaret will tell us more. So that they'll have one time they're a bit of happy, and then after some time they can be a bit sad. They may not be able to eat. They may even have issues of the baby. They are not breastfeeding, like we had our patient there. And then you have now the depression, where now this patient is depressed, and they have now the symptomatology of depression, which includes, as you're going to see as we discuss along, things. The person is very, very sad, they are low, they are no longer happy with life, they are disinterested, they don't want to eat. Then of course they may even have suicidal tendencies. They feel that they are worthless in life, they don't like anything, they don't want to talk to anybody, and they are quite down. So we can look at it in those kind of 3 spectrums.
And Margaret, just to ask you, what is the difference or similarities within all these?
Just like Dr. has explained, the main difference is the symptom severity, because when you're talking about postpartum depression, anything that falls under the broad category of depressive disorders or mood disorders, because postpartum you find it classified under the bipolar disorders, which is a mood disorder. The determining factor is the symptom severity, and what that means is the number of symptoms. The more they are, then the more severe the situation or the condition is. Like Dr. has said, baby blues is very mild, compared, not so mild to wish away, but it is mild compared to the postpartum depression. It's very short-lived, like he says. It's about mood change. It also is accompanied with exhaustion, quite a bit of exhaustion, and it doesn't go beyond 7 days. When you talk about the postpartum psychosis, it's a medical emergency, and Dr. will tell us that, because then this individual has the mania. They are up and down. It can be accompanied by hallucinations. They're hearing voices. They can even feel them on their body. They can even smell them. It can also be accompanied by delusions. And anytime you have a delusion, and delusion are false beliefs. Anytime you have someone manifesting a delusion and hallucinations, then it automatically goes to psychosis. And that's an emergency in this particular case, because postpartum psychosis, it's very easy for the mother to actually end up harming herself or harming the baby or harming someone else. So it's very severe. Very severe.
Okay.
The postpartum depression is also severe because what the individual manifests, they are full-blown symptoms of a major depressive disorder. You know, they are sad most of the time. They've lost interest, suicidal tendencies. But what tends to set aside postpartum depression is because then it manifests by the 4th week after delivery. There are some instances where they get the depressive symptoms even during pregnancy, but they're not maybe so pronounced, so they don't pay too much attention to them, and people just tend to imagine it's because of the fatigue towards the last trimester. Then the other thing that sets it completely apart is the fact that the mother is unable to take care of the baby or to take care for the baby. And it's because of exhaustion. They cry easily, they're very low in their mood, they have no motivation at all, they have no interest in things they otherwise, you know, enjoyed before, and they tend to look at them as not very good mothers. And that, when all these things are happening and going on in your system, then your outlook towards life is very negative from that point. There's a very high relationship between your thoughts, your feelings, and your behavior.
Yes.
And what happens, if we can look at this mother, is something is going on mentally. They're thinking about it. I'm not a good mother. And it makes you feel you're not adequate. It leaves you helpless.
Yeah.
It makes you feel you're not worth.
Yeah.
And so what do? Then you behave according to the influence or the impact of your emotions.
Yeah, I think that's something we've learned for a long time. You believe, you behave, and then you become. It's just your thoughts, your actions. But let's just, Dr. just join Margaret just a minute in just laying it out. What can a husband, what can a parent, what can anyone, because we all know a mother. If you're not a mother, you know someone who's a mother, who's going to be a mother. What are some of the things we can look at for them? Just in, like, we've described it, but we've described it with the symptoms. So let's just lay them out. What are those symptoms?
Okay. It's good that you have mentioned the father, because fathers are equally affected.
Yes.
And when coming to discuss issues of postpartum depression, psychosis, the blues, the fathers are also really affected, especially the first-time mothers and the first-time fathers. They are really affected. But once you see, and as you said, you know, issues of baby or getting a baby is an exciting moment. But once you see someone now not willing to breastfeed, someone who is not willing to take care of the baby, they have to be forced to breastfeed. They are not keen. A baby is crying there. They can't walk there to even, you know, hold the baby and calm them and stop them from crying. Someone who you see visitors come in and not interested, you know the usual way you'll come visitor, so they look a bit down, they look a bit sad, they are no longer interested, because pregnancy is a normal scenario. It's not a newness. So the things that you enjoy, even when you're not pregnant, you should be able to enjoy them. It's movies. So even someone is not interested, even in reading a newspaper, something they've been doing, then those are some of the signs that will tell you. If they're disturbed, they are not even able to sleep. They're waking up at night. Yeah, they're not even forming enough milk. Yeah, because they are stressed. So those are some of the signs. And of course, even the fathers, you see some of them, and I'm sure Margaret will elaborate. You know, some of them you'll not even also be interested in the babies. They're not interested in the wife. They are not excited. You know that they have a baby. They would rather see the baby as a bother, you know, and the mother as a problem. So once you start seeing those changes, instead of happy moment, being excited, they are rather withdrawn. Then you start suspecting that there could be a problem. It's time to talk to a doctor or the psychologist.
Yeah. Margaret, would you like to add anything just to the symptoms?
Adding to what Dr. has said, You also notice the change in eating and sleeping patterns.
Yeah.
It's usually one of the red flags. And the sleeping patterns, especially when you're talking about a new mother, is ideally when the baby is asleep. It's the right time also for the mother to sleep. But then they will not sleep. Alternatively, they will oversleep to the extent that even the baby in the cot just next to their bed, they won't even hear the baby. And they're sleeping, you know, way for more hours than is normal and than is usual. The loss of appetite. And specifically, watching out for suicidal ideation. Suicidal ideation is thoughts, it could be actions, and it could be words. And it could range from anything such as the mother saying, I don't even think if I died anyone really cares about me anymore. Even if I wasn't there, I was dead, I'm sure you'd still bring this baby up without me, whether I'm there or not. And this is not common talk for a new mother who is ideally very excited about it. Some of them will starve themselves. And then you also need to watch out, you know, like for neglect, and you know, towards the baby. They don't even want to give the baby a bath. They want to expose the baby. Or you go and find the baby is covered too much to an extent that it borders on, were they trying to suffocate the baby or not? Yeah. There are general behavior that is out of the norm or out of the what you would expect.
Yeah.
Yeah, it's enough to be a red flag.
I guess one thing we'd advise is if you have any of these thoughts, if you speak them out, it's easy. But I think you've highlighted that even though you don't speak them out, you will act them out eventually. So we must be careful for everything they say and what they do. Let's talk about the causes. What are some of the things that would cause postpartum depression?
Postpartum depression, the cause is really not understood. But we do think that there are some hereditary factors, and sometimes you can also have some diseases. And also endocrine factors. We do think that when a mother delivers, there are those hormones that were sort of protective, the estrogens and progesterones, we call them that way. And when the baby comes out, then that withdrawal of those hormones is thought to cause that. But it's really not something that is proven. The other now hereditary factors, if now someone comes from a family that has history of, you know, depressive illnesses, the bipolar and other psychological disorders, that also brings in a more risk factor for causing postpartum depression. There are other now diseases that we need to think about, particularly thyroid diseases. And in particular hypothyroidism, you know, the low functioning of the thyroid disease is a major cause, and it's one of the things that we normally check. So those are thought to be the factors. Otherwise, it's really poorly understood. Yeah. After
sitting with patients for you and looking at their history, are there some other things you might have discovered that may have led to their...
There's what Dr. has explained very well, the genetic aspect of it. And then we also have the environmental factors. And under the environmental factors, you know, there could be life events. For example, losses, either during pregnancy or immediately after delivery. Then this can also be triggers to depression. It could also be a traumatic event, you know, experience, anything that fits the category of anything trauma, including, and I think Dr. can qualify this, including a very difficult labor and delivery can also be very difficult for the mother to deal with. Other factors is a lack of social support. So pregnancy in itself is already too much for a mother. All the hormonal issues that are going on and the strain and the physical, you know, strain that you go through. And one of the things that mothers need, especially after delivery, is to be supported. So people to come in and take a bit of the responsibilities that they were doing, so that they give them adequate time to rest and to recoup, and so that they can also take care of the young baby. So when a mother is not getting the adequate social support that she needs, that can also be a trigger, because then they tend to get overwhelmed. And then if there is a presence of abuse, whether physical, whether emotional, whether even financial abuse, you know, where
during the pregnancy or way before.
During, it can start even during, and you know they just continue, and just the birth and the whole experience of delivery just makes it worse. And especially if you have a mother who is also taking care of other children and they don't have any help, they have, you know, no source of livelihood, so they're also worried about many other things, then that can also be one of the things that can actually push a mother to that. And then also in the recent past, and I'm sure maybe Dr. has seen this, there's a lot of things going on in the social media, you know, like everyone has become the expert coach in parenting and even young babies. And so young mothers are getting a lot of information that tends, and the pressure, you know, that tends to make them feel like I am not a good enough mother because all the other mothers have succeeded in 1, 2, 3. And this is where we tell them in therapy, please parent your child your way.
I know. It's very hard, especially when you've done sleep training and you're like, my child is sleeping all day and they're 8 months. And you're there, you're like 2 years still.
You're even doing sleep training for a 1-month-old baby.
Oh, so much pressure.
Yes.
But just to skip, we know we have, of course, how the show is flowing, but the question is, why is postpartum depression such a shameful thing? And it's not brought out to the light enough. I feel like we must, you know, dispel the myth of it's not shameful, it's not you're not failing, you know. Doctor, can you affirm somebody who's watching this day?
Yeah, I think it's important for us to really come out straight and encourage, you know, people to come out and discuss about postpartum depression. Because it is, and I'm sure Margaret will tell us, it has really good, you know, the end of it is good because it has a good, the process, the prognosis, the healing. You know, most patients come out of it, as we saw in the video as we began the program. So, and it is not that they are weak in a way. It is not that they are not enough mothers. It's just the circumstances, the factors that we mentioned that have brought them, and the fact that they were pregnant, and as you say, and Margaret has mentioned that the mother during pregnancy, it's really a heavy toll on the mother. You know, carrying that baby those 8 months, there are so many changes in the body, both hormonal, you know, the respiratory system, the blood system. It's quite a stress. So when those triggers come in, it is not that they are weak. It is only that it's an event that comes, which only is for a time. And when you have enough social system, right from the house, you know, the husband, the family, you know, and then the public in general, we are able to destigmatize postpartum depression.
Margaret, would you encourage someone who's watching even as we continue?
I think the stigma around postpartum depression is from the last word, depression, which mostly is around mental health disorders and illnesses, and just the fact that it is classified under that, then that just tends to compound the challenges with it. And I think also there's a social angle towards it as well, and a societal angle towards it as well. There's the expectation that every new mother will be so happy and so excited about their baby. And so when you don't seem to really embrace your baby the way everyone expects you to be, then you're considered to have a problem. And I think that's what Dr. is saying, that if you have PPD, then you're seen like you're not a good enough mother, you are not ready, or there's just something terribly wrong about it. But I guess that comes from the fact that we don't have the knowledge and the awareness of the other triggers. Because if you are a mother, you have a newborn and you have another 1-year-old baby, you haven't even, you know, perfected well in parenting the other child. And then that just becomes a double responsibility. Now, think about a mother who is also taking care of a child with special needs. Think about a first-time mother who has a child who is sickly from birth, and the toll, you know, and the pressure of taking care of that baby. So it's not because they don't love the baby. Let's just demystify that.
Yes.
That's not true. And it is not because they are not good enough mothers, and it is not because they were not ready. Because the 9 month, of course, you knew, I mean the 8 months, you knew you would get to the 9 month and you'd have the baby. So it's not because of their mother, it is the circumstances and the forces and the triggers that pushes that mother. And if that mother didn't have postpartum depression, they can also get major depressive disorder.
That's true.
Yes.
You are watching Health Check on Hope TV, where you look and live. Today we're talking matters postpartum depression. Now what has come out is that it's a mood disorder and it's treatable and you can be taken good care of. The question I'd like to ask now is, are there some things one can do to really avoid getting to this place during the pregnancy, before?
Yes. Yes, if we as health practitioners do educate the public and the mothers, and especially us in the reproductive area, we do what is called risk assessment. So because there are mothers that you know we need to have some history from. For example, mothers who have had postpartum depression before, blues or psychosis.
So do you mean that this is a recurring?
Yes, it
disorder
can
as
be
well?
recurrent.
Okay.
It can be a recurrent problem.
We'll talk about that.
Yes. So if there's such a history, you know, during the antenatal period, if they've come from a family that has psychological disorders, they are being treated, then we need to take care of such people, because mothers, because later they can't develop that. If there are mothers who have had maybe a difficult pregnancy, maybe they were not treated well, they felt they were not treated well, maybe mothers with the twins also. Mothers with bad obstetric history, recurrent pregnancy losses and such. Mothers who maybe had history of sexual abuse. Mothers probably they came from they're coming from probably an unstable family, the husband and the in-laws. Yeah, so such history should be able to trigger that there could be a problem. If they have diseases like thyroid disease, those are mothers that we need to be alert about, so that when they deliver, then someone should be there to be ready. Some of them, we can even start on some treatment. I'm sure Margaret will confirm that if we have the strong suspicion and the clinical symptoms are suggestive that they are likely to develop, to go into postpartum depression, then we can do that. So it's an issue of being very keen during the antenatal period and doing a risk assessment of such mothers, and then do close follow-up as they deliver, and good care, and make sure that wherever they're delivering, their psychologists, their doctors, are waiting possible development of postpartum depression.
As you answer the same question, I'd like you to highlight when is the best time to introduce a mother to now your kind of support.
The best time is when there is onset of symptoms.
Okay, and what does that mean?
Immediately. When you begin to see any of the symptoms that we have highlighted, whether it is during pregnancy or whether it is immediately after delivery, because even though we are saying that onset of symptoms is the 4th week or after the 4th week, for some people the symptoms emerge at the 6th month. They've had a pretty good time, and then by the 6th month something has happened. So immediately you can see that there's a change. Then that's when psychotherapy should start immediately. The other thing is immediately also when a mother has had a life event, like a loss, whether loss of a job or loss of a family member or a traumatic experience, or like probably a comorbidity of another, another health condition, then that is also the right time to actually refer this mother to seek help, both medically from a medical practitioner and from a psychotherapist. Also, when, for example, if the mother was on substance use, and especially alcohol, and alcohol is a depressant, so also the withdrawal of it, probably because the mother doesn't have access to the alcohol during the time of breastfeeding. Then that can also be a trigger. So when you notice something that is out of the ordinary, we don't wait until we have the full-blown, you know, all the symptom cluster of the symptoms. Just 2-3 major symptoms, especially about not wanting to bond with the baby, a bit of neglect with the baby, or neglect of the mother herself and her hygiene, then that's a red flag enough that we need to seek help.
Okay.
Yeah.
Absolutely. Miscarriages and postpartum depression, where do those two meet?
It's a loss because in a pregnancy the mother is anticipating to get a baby.
Yes.
And most miscarriages always are quite recurrent. And so it's normally a loss. It's grieving. They are grieving because they have lost a baby, and they take it. They have actually lost. You know, we always would want them cancelled and talked to. So, because if they are not done that, most of the time they will develop that. Again, there's always fear. Yeah, if they had a miscarriage and now they are pregnant, they always look at this one aired like the other one. Yeah, are there issues? Now that I had a miscarriage, will I have another pregnancy loss this time? Even if they go into delivery, they want to actually see the baby and hold the baby. So it's always that event. But that loss, if not taken care of, if the mother is not cancelled properly, then it always inclines to developing postpartum depression.
Yeah. We're taking all your questions on 22232. That is the text line. Send them in, and then we'll also be picking up your calls. The number is right below the screen. You can get ready to be calling as we continue with the conversation. For you, I'm sure you've met people who've gone through miscarriage after miscarriage, or just how does that look like?
A loss is a loss. Whether the loss of a phone or the loss of a miscarriage, or whether the loss of a job, it's a loss. And they go through the stages and they grieve. The loss of a pregnancy is very intimate. Extremely intimate, because you had a baby growing inside of you. You had already formed a bond in a relationship from as early as when the mother discovers that they're pregnant. And so it's not just that I lost a 4-week pregnancy or 8-week pregnancy. It's the loss of a life, it's the loss of a relationship. And then you also have to deal with the mother and walk the mother through the process of grief to the point of where they have to mourn that loss of a pregnancy. They have to grieve, and sometimes grief can be very, very complicated when you're talking about miscarriages, and especially if it happens towards very late, you know, like towards the last trimesters. And in instances, you will even find, you know, like mothers who prepare very early, you know, they've done shopping, they've made up their rooms, and now they have all these things that they had done. They had made the preparations. Daktari will tell you some mothers book hospital as early as 6 months. They've already booked and paid. And so you have to walk them through the journey of now living without the pregnancy. And the most difficult, especially about a pregnancy that's quite advanced, is the questions that you have to prepare the mother to face. Because probably you met her when she was about 5 months pregnant, and you could see, and then the next time you meet her is 3 months later, and the question is it a boy, is it a girl? You know, congratulations. So then that's also a journey that you have to walk the mother. And in this case, the ideal situation, it's not just the mother alone. It should be the mother and the wife and the husband as well. And if they have children who are older, then also they need to be walked through that journey to also deal with it.
I think that's very, very true and very, very important to discuss, especially with the children. I mean, mom went to hospital and she didn't come back with a baby. And her stomach kind of still looks big. So like, is the baby still in the stomach? What's happening? And no one is, telling the kids anything. So that's really important. Is there going to be a funeral? You know, many questions need to be answered right there. With this, and after all this, and I'm sure there's still parts we're going to get back to as we continue to ask the question, how is postpartum treated? And I think I want to start with you, and then I come to Daktari.
There are two ways of treating postpartum. There is the pharmacology bit of it, which Daktari will talk about.
Pharmacology, please explain.
Medicine
20 marks.
From a doctor.
Okay.
Sorry, from the medical point,
Okay.
from the prescription, medication, there is that bit. And then we have now the psychotherapy or the counseling bit of it now, where the psychotherapy now is the individual mother who is going through postpartum, and then the family.
Okay.
Yes.
As a unit.
As a unit.
Okay.
We saw the case of Jane,
Yes.
and the husband was very supportive. And the reason we also want to bring in the family on board is you also must remember there is compassion fatigue. So the caregivers also need care, and they also get tired, and they also need to appreciate what is their role. The other thing we need to bring in a spouse is when it comes to mental health illnesses, you have a higher chance of success when you have a treatment buddy. And the treatment buddy, like in the case of Jane, was the husband who would even wake her up, feed the baby, take the medication, who would, after 2 weeks, she's going to see a psychologist. After another 1 month, she's going to see the psychiatrist to make sure that those appointments are honored, who make sure, to the extent of doing a pill count, to make sure that the medication they are taking it as prescribed.
Yes. Wow.
And the treatment buddy can also be even a very close friend. You come in and you want to support your friend to walk through that. So we look at it from a counseling point of view, and then Daktari looks at it from the point of prescribing the medication.
Okay.
Yeah.
Daktari, what happens? There's medicine that one needs to take during this time. Just take us through that.
Yes, thank you. The postpartum blues normally are transient, so most of the time those ones will not need any medications. It's an issue of psychosocial support.
Okay.
And you have the right psycho support within a few weeks, 1 week to 2 weeks, then that one normally clears.
Okay.
But such a mother needs to be taken care of, because with the postpartum blues it can always degenerate and become the other worse conditions, the psychosis and the depression. Margaret mentioned about psychosis being an emergency. Yes, it is a psychosocial emergency, and normally they have to be admitted to hospital.
Okay.
And when they're admitted to hospital, the psychiatrist has to come on board.
So wait, so what happens to the baby?
Then most of the time the baby is left at home to be
Okay.
taken care of, because in such a situation the mother is not able to take care of the baby.
Okay.
Yes, I mean they are confused, they have no interest, they don't want to breastfeed. I mean they sometimes they can be quite they have emotional ability. And they are not eating, they are not drinking, they need to be given medication, they need to be sedated to a point. So most of the time the baby has to be left at home, and someone has to take care of the baby, but they have to be admitted.
Okay.
Because she mentioned even suicidal tendencies can be an issue. So we are talking they have sort of a mental breakdown. So those ones have to be given medications. And there are various medications the psychiatrist will prescribe. When it comes to the depression, the postpartum depression, again, they are antidepressants. And it's sort of a long-term kind of a treatment. And they have to be under the care of the psychiatrist. And there are various medications that psychiatrist will give. But to go hand in hand, as Margaret has said, is the psychotherapy bit. Very, very important, because on top of the drugs, the drugs are going to modify their meditation. But how are they going to cope? Yeah, because the issue of depression, the issue of psychosis, is also about coping mechanism. We have mentioned before that there are triggers, and some of them, maybe the husband is mistreating, maybe in the in-laws, maybe the financial, maybe the labor was too much. It's an issue of coping. So and that's where the psychologists, Margaret, they come in very, very handy, because they're supposed to now kind of take care of that patient. And the drugs are doing their bit in terms of, monitoring the medication. And then they'll come in and try and help the patient cope with the situation. Because it is a situation. And what is happening is that the situation is overpowering their coping mechanism. So the drugs is trying to bring them down. The psychologist is trying to show them how to cope. There is also electroconversion therapy that the psychiatrists also give.
That's French, but it's okay.
Yes, but they need they need an anesthetist to sedate them, and it's a kind of, if I could just some electrical waves are passed into the body. So it's a kind of like it's a changeover, so that you brought into something new, so that when you wake up, it's like now you're supposed to think differently.
So is it a reset button?
Sort of a thing. It's
a shock.
A shock, yeah. You're kind of sort of put in a shock, and when you wake up, things are different. So on top of medication, they also do that. But basically, the psychologist comes in handy for that.
And just because we have you here, and we have to take all the advantage we can you just share a few coping mechanisms that, one should be able to have, even by the time they're getting to you, able to partner?
One of the things is, of course, you encourage the mother during her pregnancy to do whatever they can to just enjoy that pregnancy. It's a very unique, very intimate journey. It's something to be proud of, not to be stressed about, except now the external triggers that pushes someone to be on the complete opposite side. So it's very important that you prepare yourself mentally towards being a mother. Start thinking about how you're going to parent this baby. What are the things you want your baby to learn from you, and everything else. Number two, it's very important. Attitude is everything. So whatever your attitude towards your journey of becoming a mother and pregnancy determines a lot about your emotional state. And so we encourage them, please try in as much as possible, maintain just the right attitude. There is the bit of self-care for the mother, and self-care for the mother here means sleep, get enough sleep and adequate sleep. It's very important. Make sure you're eating the right diet, and that's where Dr. will always tell pregnant mothers, please go and see a nutritionist to walk you through that dietary journey. The exercises that you can do. The thing about exercises, even when you're pregnant, there are still that you can do, is that exercises helps release a hormone, the endorphins. And the endorphins is a feel-good hormone. It calms you down, it makes you happy and relaxed. And that's also what helps you get a good night's sleep. Keep the right company.
Oh, yes.
It's very important that you keep the right company.
People will keep telling you, hey, your neck is dark. Oh, your people, avoid.
You just keep the right company. A supportive environment, a facilitative environment that understands you. And it's also important for you to understand that no one expects you to be performing 100%. Like you are doing things in terms of energy, being all over, taking care of everyone as you used to before. So don't beat yourself too hard if you see like now your energy level is a bit slow. You actually need to conserve as much energy for delivery before you meet Dr.
Yes.
And then anytime you're confronted with a challenge, always strive to resolve the challenge, but not to sweep it under the carpet. And then plan about your life, what you do, identify the right people who are going to walk with you through the journey. And never shy to ask for help. You're more courageous and brave when you ask for help, whether during pregnancy or even after. Even if it is help of someone coming in to spend a bit of 1 hour with the baby so that you can sleep well, that is okay. Please ask for that help when you need it. You're not being disabled or irresponsible. It's part of self-care, which is very important.
Thank you so much for that. When we come back, we'll be picking your calls live and going ahead also with your SMSs. 22232 is our text line. Maximilla, thank you for letting us know you're watching, because we're also live on Facebook. So if you'd like anyone to watch this, you can share that Facebook link on your Facebook to everyone. They'll get to see it. And also Gishaga Alicia, thank you so much, watching from Johannesburg in South Africa. Thank you so much for that. On our text line, our question is about this medication that can induce, maybe work in reverse and induce suicide. Is there any such thing, if I got the question correctly?
I don't think, Daktari, there is really medication that can push anyone to committing suicide. However, there are some drugs that by themselves, the nature of the chemical composition of the drug is more depressing.
Okay.
And so sometimes, actually that's a good point to bring out here. Sometimes even when you're talking about depression, there is depression that is medication induced, or related because of the drug that you're taking. However, then that is something that the doctors can deal with, because then if as a result of taking that drug, then you manifest the depressive symptoms, then you need to go back to the doctor and the doctor can change that.
Yes.
Suicidal ideation is basically one of the red flags of depression.
Okay.
Yes.
Okay.
But it can be triggered by substance use as well. Yes.
So actually, Alex is one who's texted in and asked, in other forms of depression, there are cases of medication-induced suicide. And also, what is your experience in postpartum depression? I'd like to know, maybe you guys can share if you have your own experiences. And also, is recovery better? Is recovery there? That's Alex texting in.
For postpartum depression?
Yes, sir.
Yeah, the postpartum depression psychosis, the recovery is quite good. Yeah, I don't know the percentage, but it's quite high. And especially the blues, those are self-limiting situations, psychosis and postpartum depression. Some of them, if not well managed, not well tackled, can go into now major depressive illnesses. But it has really a good outlook. When it is really managed, you have the support system, they follow the psychologist advice and the medications and all those coping mechanisms that Margaret has alluded to. It's really, they come up very well, but a few may go into major depressive illnesses in the future.
Okay. We're about to go for a short break. When we come back, much more on postpartum depression, a mood disorder, and we've been advised and told, talk about it. It is okay. You are not failing. If you're going through it now, this is the best time for you to get treatment. Do not harm yourself. Do not harm your children, and you're going to be fine. There's a huge chance of recovery. With me in studio, one more time, you can introduce yourself and what you do. For those who just joined us, karibuni sana. You're not so late, you're very late.
Thank you. I'm Dr.Wachira Murage, Obstetrician and Gynecologist.
Yes.
My name is Margaret Mbuthia. I'm a clinical psychologist.
Okay, we'll be right back. After the break, we'll be taking your calls live. So get ready to ask any questions. Consultation is free. It's paid by Health Check. We're gonna pay for you. See you shortly.